Healthy intimacy after 60 is one of the most misunderstood and overlooked topics in medicine, yet it profoundly affects emotional well-being, physical comfort, and overall quality of life for millions of women. Many women tell me they feel invisible in this area, as if their intimate lives simply faded into the background once menopause arrived. But the reality is far more hopeful, far more empowering, and far more supported by medical research than most people realize. Your intimate life does not have an expiration date, it simply evolves, and you have more options today than ever before to maintain comfort, desire, and fulfillment. One of the biggest challenges women face is that society has rarely made space for honest conversations about sexuality in older age. Women over 60 are often portrayed as disconnected from intimacy or uninterested in it, when in reality, research shows something very different. Many women remain intimate well into their 70s, 80s, and beyond, and a large number even report feeling more emotionally connected, more confident, and more in tune with their partner than earlier in life. What changes is not the desire for closeness, but the body's natural rhythm, the way physical responses occur, and the kind of support the body needs. After menopause, which generally occurs between ages 45 and 55, the body undergoes major hormonal shifts. Estrogen levels decline significantly, and this affects far more than reproductive function. Estrogen influences the skin, bones, brain, bladder, pelvic floor, blood vessels, and even emotional regulation. When estrogen drops, women may experience vaginal dryness, irritation, discomfort during intercourse, changes in libido, urinary symptoms, or shifts in natural arousal patterns. For some women, these symptoms are mild, for others they become disruptive. But none of these changes mean your intimate life is over. They simply mean your body needs different support. So unfortunately, many women internalize these symptoms as just aging and never mention them to their doctors. Research from Menopause Journal found that fewer than 40% of postmenopausal women talk to their healthcare provider about sexual concerns. Even more concerning, when women do bring it up, some report feeling dismissed or brushed off. This creates a cycle where women assume what they're feeling isn't important enough to address, or that there's nothing that can be done. But sexual health after menopause is a legitimate part of medical care. It is connected to cardiovascular health, mental health, relationship quality, and physical comfort. You deserve care in this area just as much as any other part of your health. One of the most common physical changes that occurs after menopause is something called genitourinary syndrome of menopause, or GSM. Earlier generations referred to this as vaginal atrophy, but GSM is a more accurate term because it includes changes in the vagina, vulva, bladder, and urinary tract. With lower estrogen levels, the vaginal tissues become thinner, more fragile, and less elastic. The pH becomes less acidic, which increases susceptibility to infections. Blood flow to the pelvic area decreases, contributing to dryness and discomfort. For some women, even everyday activities like sitting or walking can feel irritating. But GSM is treatable. This is one of the most successful and well-researched areas in women's health, and the solutions available today are not only effective, but also safe for most women. Vaginal moisturizers, different from lubricants, can significantly improve comfort when used regularly. They help maintain hydration in the tissues over time. Lubricants are used only during intimacy to reduce friction and discomfort. Medical-grade lubricants and moisturizers specifically designed for vaginal tissue have been shown in multiple studies to reduce symptoms and improve satisfaction. Then there is vaginal estrogen therapy, one of the most important tools in postmenopausal sexual health. Unlike systemic hormone therapy, vaginal estrogen delivers a very small amount of estrogen directly to the tissue that needs it most. Because only minimal amounts enter the bloodstream, it is considered safe for the majority of women, including those who cannot take systemic estrogen. Research published in the New England Journal of Medicine shows that vaginal estrogen can restore tissue thickness, improve lubrication, increase blood flow, and significantly reduce pain. Many women describe feeling like themselves again after a few weeks of treatment. However, vaginal estrogen is not for everyone. Women with certain types of breast cancer or specific medical histories must discuss risks carefully with their healthcare provider. This is why individualized medical guidance is essential. What works beautifully for one woman may not be appropriate for another, and only your doctor can determine what is safe in your particular situation. For women who cannot use estrogen in any form, there are still excellent alternatives. Ospemifene, an oral medication, and prasterone, a vaginal DHEA insert, have both been approved for treating painful intercourse related to GSM. These therapies work through different pathways, but ultimately help restore vaginal tissue health. The key is understanding that there is no single universal treatment. Instead, there is a menu of medically supported options tailored to your needs. Beyond the physical changes, emotional and psychological factors play a huge role in intimacy after 60. Many women experience changes in desire not because they no longer care about closeness, but because other factors interfere with natural arousal. Medications are a common contributor. Certain antidepressants, blood pressure medications, allergy medications, and even acid reflux medications may affect desire or arousal. If libido suddenly changes around the time a new medication is started, this is worth discussing with your doctor. The solution might be as simple as switching to another medication in the same class. Stress is another major factor. Women in their 60s and 70s often carry heavy emotional loads, caring for aging parents, supporting adult children, adjusting to retirement, managing health conditions, or processing grief. These emotional stressors can make it difficult to be mentally present during intimacy. It's not a lack of desire, it's mental exhaustion. Research in Menopause journal shows that treating depression, anxiety, or chronic stress can lead to significant improvements in sexual desire and satisfaction. Body image also plays a profound role. Our culture promotes unrealistic standards of beauty that leave many older women feeling unseen or self-critical. But studies consistently show that satisfaction with one's sexual life is more strongly linked to body acceptance than to physical appearance. In fact, women who practice self-compassion, accepting their bodies with kindness rather than judgment, report more emotional connection, more pleasure, and more confidence. This has nothing to do with weight, wrinkles, or age. It has everything to do with mindset. For women in relationships, communication becomes one of the most powerful tools for maintaining intimacy. Partners also age. Many older men experience erectile dysfunction, which affects up to 70% of men over age 70. These parallel changes can either bring couples closer together or create distance. What makes the difference is whether the couple talks openly about their needs, concerns, and expectations. Avoiding the topic, hoping things will fix themselves, or assuming your partner knows how you feel rarely leads to improvement. Instead, couples who make intimacy a conversation rather than a silent struggle often report stronger emotional bonds and even an improvement in physical closeness. For some couples, intimacy after 60 becomes less about performance and more about connection, comfort, and shared experience. For women who are single, intimacy takes on different questions. Some feel relieved to be beyond relationship expectations and choose to focus on self-connection, comfort, and well-being. Others are curious about dating again, which comes with new emotional and physical considerations. And some simply want to understand their bodies better, regardless of partner status. Every one of these experiences is valid. There is no correct approach to intimacy after 60. Your comfort and desires set the tone. Health conditions common in older age can also influence intimacy. Diabetes, cardiovascular disease, arthritis, incontinence, and cancer treatments all impact sexual function in different ways. The key is understanding how and knowing that these conditions do not remove the possibility of sexual well-being. Rather, they shift the strategies needed to achieve comfort and pleasure. For example, diabetes can affect nerve sensitivity and natural lubrication, making arousal more challenging. Cardiovascular disease affects blood flow to the pelvic area. Arthritis makes certain movements difficult, but modifying positions and using pillows or supports can make intimacy far more comfortable. Urinary leakage, while understandably embarrassing, can often be dramatically improved with pelvic floor therapy. And cancer survivors, especially those treated for breast or gynecological cancers, frequently experience changes in sexual function that can be addressed with appropriate medical support. Pelvic floor health becomes especially important after 60. These muscles support your bladder, uterus, and rectum. They play a major role in sexual sensation, arousal, and orgasm. When they weaken, women may experience decreased sensation, incontinence, pelvic organ prolapse, or discomfort during intercourse. Kegel exercises are often recommended, but research shows that many women unknowingly perform them incorrectly, over-tightening, pushing instead of lifting, or using the wrong muscles entirely. Pelvic floor physical therapy is one of the most effective ways to restore muscle function, improve control, and increase sexual comfort. By this stage in life, women deserve to hear one message loud and clear. Nothing about this topic should ever be a source of shame. You are navigating natural, predictable, biological changes that occur in every woman, yet you are doing so in a world that has rarely given you the information or support you deserve. This can create feelings of embarrassment, frustration, or isolation. But you are not alone. Millions of women are experiencing the exact same questions, the exact same worries, and the exact same changes. What matters now is giving yourself permission to ask questions, seek treatment, speak with your doctor, and explore options that help you feel physically comfortable and emotionally connected. Healthy intimacy after 60 is absolutely achievable, but it begins with knowledge, compassion, and open communication. Here you go, Jeff. Part 2, 2,500 words. Completing the full 5,000-word polished script in paragraph style, keeping Dr. James Wilson's empathetic, senior-friendly medical tone. As we continue, it's important to understand that intimacy after 60 becomes less about quick fixes and more about whole-body wellness. When women tell me their desire has changed, their arousal feels different, or their comfort has declined, the solutions often involve multiple layers: hormonal support, emotional well-being, communication, pelvic floor strength, and lifestyle habits. Think of your intimacy the same way you think of heart health or joint health. It benefits from consistent attention, mindful habits, and supportive care. There's nothing indulgent about addressing it. It's an essential part of your well-being. One area I encourage every woman to explore is the relationship between lifestyle factors and sexual health. Regular movement is incredibly powerful for circulation, mood, and hormonal balance. In fact, studies in the Journal of Sexual Medicine consistently show that women who engage in moderate physical activity, walking, swimming, yoga, or strength training, report better sexual function than sedentary women. This happens because exercise increases blood flow to the pelvic area, supports cardiovascular health, boosts endorphins, and enhances confidence. You don't need intense workouts. Even 20 to 30 minutes of walking a day can make a meaningful difference. Sleep also plays a surprisingly large role. Poor sleep affects hormone regulation, stress levels, and mood, all of which influence intimacy. Postmenopausal women often struggle with night sweats, insomnia, or disrupted sleep cycles, which then influence desire and energy levels. Prioritizing sleep hygiene, keeping the bedroom cool, limiting evening screens, maintaining sleep schedules, can quietly but powerfully support your sexual health. Nutrition is another important piece. Diets rich in whole foods, especially those supporting cardiovascular health, tend to improve sexual function as well. Omega-3 fatty acids, antioxidant-rich fruits and vegetables, and adequate hydration all help with blood flow and tissue health. Women with diabetes, high blood pressure, or cholesterol concerns may experience more intimate difficulties if blood sugar and cardiovascular markers are not well controlled. By improving these factors through diet and doctor-recommended treatment, Many women find their sexual function improves too. Another crucial aspect is stress management. Chronic stress raises cortisol levels, which directly interferes with libido and arousal. Women over 60 often manage multiple responsibilities, caring for grandchildren, supporting adult children financially or emotionally, balancing medical appointments, or navigating big transitions like retirement or widowhood. Stress is not just emotional, it's hormonal, and high cortisol has real physical effects on the body's ability to experience pleasure, comfort, and arousal. This is why mindfulness, meditation, gentle movement, breathing exercises, and even therapy can provide indirect but powerful improvements in sexual well-being. When the mind is calmer, the body is more receptive. Many women discover that by prioritizing their emotional health, their desire and enjoyment naturally increase. One of the most empowering things women can do for themselves is schedule a dedicated appointment with their doctor, specifically for intimate health. Rather than mentioning it at the end of a rushed appointment, when time is short, consider purposely booking an appointment just to discuss these concerns. It allows space for your doctor to ask questions, review treatments, and take your symptoms seriously. I've seen countless women suffer in silence for years simply because they didn't want to bother their doctor with something that felt personal. But this is medical care. You deserve to be heard. When preparing for this appointment, write down the exact symptoms you're experiencing. Is intercourse painful? Is the discomfort burning, stinging, or tightness? Does dryness occur daily or only during intimacy? Do you have urinary leakage or urgency? Has your desire decreased or is it difficult to become aroused? The more specific you are, the easier it is for your provider to help. And if your concerns are dismissed, you have every right to seek a second opinion. Women over 60 often underestimate how much impact their medications may be having on their intimate health. As I mentioned earlier, common medications, even those unrelated to hormones, can affect desire, arousal, and sensitivity. Antidepressants, blood pressure medications, allergy medicines, and even some over-the-counter sleep aids can cause dryness or reduce desire. Never stop a prescribed medication without doctor guidance, but absolutely bring this up. There are often alternative options with fewer sexual side effects. Another critical piece is understanding the emotional shifts that come with aging. Women may feel anxious about their changing bodies. They may feel hesitant undressing in front of a partner after decades of physical changes. They may feel grief over the loss of the spontaneous intimacy they enjoyed in younger years. These feelings are deeply human, and acknowledging them, not pushing them down, is the first step toward rebuilding confidence. Confidence often grows when women shift their focus from appearance to connection. Intimacy after 60 is not defined by flawless skin or perfect energy levels. It is defined by emotional closeness, shared comfort, trust, and presence. Many women describe feeling more connected to themselves and their partner in their 60s and 70s than in their 20s, because intimacy becomes slower, more intentional, and less pressured. Women who are single often worry that starting a new intimate relationship later in life will be awkward or difficult. But research shows that older adults who begin new relationships report high levels of satisfaction, often because they bring emotional maturity, clearer communication, and deeper self-understanding into the relationship. If you choose to date again, conversations about comfort, expectations, and sexual health can be empowering rather than intimidating. Another area worth exploring is the role of non-penetrative intimacy. Many women assume that if intercourse becomes difficult, their intimate life must come to an end. Yet intimacy is far broader than intercourse. Touch, closeness, massage, kissing, shared affection, warm conversation, and emotional connection are all forms of intimacy that can bring profound satisfaction. Many couples shift their intimate routines, exploring alternatives that focus on comfort and pleasure rather than performance. Older couples frequently report that their intimacy becomes deeper, slower, and more emotionally meaningful. Pelvic floor therapy remains one of the most powerful tools for women experiencing discomfort, decreased sensation, or urinary leakage. These muscles are responsible for support, arousal, orgasm, and continence. When they weaken over time, through childbirth, menopause, weight changes, or age, women may experience reduced sensation or pelvic heaviness. Pelvic floor strengthening, guided by a specialist, can significantly improve sexual sensation and confidence. Women often tell me they wish they had known about pelvic therapy decades earlier because of how transformative it is. Let's take a moment to talk about communication with partners again, because this is where many relationships either strengthen or struggle. When women experience discomfort or loss of desire, they may avoid intimacy altogether, not because they don't care about their partner, but because they fear discomfort, embarrassment, or disappointing them. But many partners misinterpret this withdrawal as rejection or loss of affection. A simple, honest conversation can prevent months or years of misunderstanding. It's helpful to start with I statements. For example, "I've been experiencing dryness, and I want us to find ways to make intimacy more comfortable. I value our closeness, and I want to explore options together. I'm dealing with some body changes, and I'd love your patience as I navigate them." Partners often respond with relief, empathy, and understanding when they hear the truth behind the changes. Intimacy is not just physical, it's emotional, and vulnerability can bring partners closer together. For women with partners also facing health challenges, such as erectile dysfunction, it's essential to remember that intimacy is a shared experience. Many men over 60 experience performance anxiety or frustration. Working through these changes together, rather than in silence, helps both partners maintain connection. If communication becomes difficult, couples therapy can be incredibly helpful. Therapists who specialize in older adult intimacy, sexuality after menopause, or relationship transitions can guide these conversations in a safe, supportive environment. Many women tell me that therapy gave them the courage to talk openly after decades of silence on the topic. Another important shift after 60 is reframing intimacy not as a spontaneous, sudden event, but as something that can be planned, prepared for, and anticipated. This doesn't make it less meaningful. It often makes it more satisfying. Preparing involves using moisturizers regularly, setting aside time to relax, engaging in touch or closeness before intercourse, and creating an environment that feels comfortable and safe. For many women, the slow buildup becomes more fulfilling than the hurried intimacy that might have been common when life was busier. The emotional closeness that grows from intentional intimacy can be deeply satisfying. Women often describe the physical aspect as only one piece of their connection. The emotional connection becomes just as important, if not more so. Finally, one of the most important messages I want every woman over 60 to understand is this: you deserve to feel comfortable in your own body. You deserve to experience pleasure if you want it. You deserve to have your concerns taken seriously. You deserve healthcare that acknowledges your needs, not healthcare that tells you to accept discomfort because you're older. The stigma surrounding older women's sexuality is not based on biology. It is based on cultural misunderstanding. There is nothing unnatural, embarrassing, or inappropriate about wanting intimacy at any age. Many women discover that intimacy after 60 is more emotionally rich, more collaborative, and more deeply satisfying than earlier in life because they know themselves better, communicate more openly, and have a stronger sense of emotional maturity. As you move forward, consider embracing compassion toward your body rather than judgment. Recognize the strength and resilience of your body after decades of life experiences: childbirth, stress, illness, growth, and adaptation. Your body has served you through countless seasons. Now it deserves kindness, attention, and support. Healthy intimacy after 60 is not about forcing your body to behave exactly as it did at 20. It's about understanding your body as it is now, supporting it with the right tools, and honoring the emotional and physical changes that come with aging. Whether you choose to be intimate with a partner or simply want to feel more comfortable on your own, the goal is the same: confidence, comfort, and empowerment. Before we close this script, let me leave you with practical steps to start applying today. Be direct and honest with your doctor about your concerns. Be patient and compassionate with yourself as you explore new patterns of intimacy. Communicate openly with partners, expressing what feels good and what doesn't. Use vaginal moisturizers regularly and lubricants during intimacy. Ask your doctor whether vaginal estrogen, DHEA, ospemifene, or pelvic therapy might be right for you. Engage in gentle exercise, prioritize sleep, and focus on stress management. If you're single, allow yourself to explore your comfort and desires without judgment. And no matter your situation, remind yourself daily that you are worthy of comfort, closeness, and joy. Intimacy after 60 is not a fading chapter. It is a new chapter with different contours, deeper emotional meaning, and more mature connection. When supported with knowledge, compassion, and communication, this chapter can be every bit as fulfilling as any that came before it, and you deserve nothing less. Thank you for spending this time with me today. If you found this information helpful, I want to invite you to stay connected with this community. Go ahead and subscribe to Senior Vitality Clinic, where we talk openly and honestly about the health topics that matter most after 60. If you have a question or a concern you'd like me to cover in a future video, please leave a comment below. I truly do read them, and your questions help guide the next topics we explore together.